I save teeth. I'm the superhero for saving teeth. That's what I do.
Okay, good.
And so a lot of times I'm that second opinion after someone's been told, you got to lose your teeth.
Like your teeth have to go.
Your teeth have to go. And then the patient goes, is there anything else you can do for me, doc? They'll send them to me. And sure enough, I can save teeth that a lot of other dentists would just put X's on.
So you've actually been told, people come to you and say, my teeth have to go.
Oh, yes.
And their teeth don't have to go.
True.
And so what are you doing differently? Or how are you looking at it differently?
I look at it differently because I know what the body can do. I know the miracle of the body's ability to heal and regenerate itself. That's what periodontists have a lot of insight into that general dentists may not really understand. So I know what the potentials are. I know that there's hope where a lot of other dentists may not think so.
So moving on to today's topic, gum disease. And there's new treatment options. What defines it, or what are the symptoms?
I would say a person would notice bleeding of their gums.
All right. Like bleeding when? I mean, just
when they're brushing, when they're flossing, sometimes when they're eating.
A little bit when you floss?
Bad technique, yeah.
Okay.
But usually you shouldn't have bleeding when you're flossing. That's a sign that there's inflammation or infection.
And you're headed for?
Well, you're headed for possibly more inflammation, possibly bone loss, loose teeth. I mean, it's a long chain of events, but the early signs can be bleeding. It can be sensitive teeth to hot and cold.
All right.
It can be periodic swellings. It's amazing how many patients I get who have had abscesses in their mouth. Rinse with peroxide, do a little home remedy action. It works, so they figure they're okay.
Okay.
Not the case. It's a slowly sneak-type disease.
So puffy gums.
Puffy gums, swollen gums. But because it slowly develops, a lot of times people think that this is just the way I am.
Yeah, okay.
This isn't a big deal, and it is.
So it's a matter of just getting in
early, keeping up with your dental care, and having a particular type of examination known as a periodontal exam, where the dentist measures around each tooth. That's really the only way to know.
Okay. Now, my original question of what is periodontal disease, I mean, we asked the symptoms, but you say it's an infection under the gum line.
It's an infection under the gum line.
And by the way, is periodontal disease the same as gum disease?
Well, we're talking
Loosely.
different terms. Yeah, they're lay terms. Like gum disease is a very broad topic. Specifically, scientifically speaking, you have gingivitis, which is just the gum tissues infected. Then you can have periodontitis, which means that you also have the loss of bone.
Okay.
A significant difference.
All right, all right.
It's an infection under the gum line that can progress to the loss of bone support around the teeth and then the eventual loss of the teeth.
Now, how big of a problem is it, by the way? It's the #1 way people lose their teeth? Is that right?
For adults, it's the #1 cause of adult tooth loss.
Okay.
The statistics are going to increase. There's a major study going underway that is going to show that the prevalence of gum disease or periodontitis is even more than what we thought. So I think that data will be coming out soon. I'm not sure when it will be published. I kind of got the inside scoop from the president of the American Academy of Periodontology, but the numbers are going to show that more people have advanced gum disease than what we once thought.
Okay, now the good news is, you say with this laser,
yes.
with the right candidate, you can wipe it out. No more bleeding gums, bad breath, things like that?
Yes, I can control periodontal disease. I can't say that I can cure it, because it's a chronic infection. It can be well managed, just like people are walking around with well-managed hypertension, well-managed diabetes. I can help patients manage their periodontal disease, keep their teeth, have a healthy mouth, fresh breath, no bleeding, no swelling. I can minimize all of those symptoms.
Why the breath? How does gum disease or periodontal disease affect the breath?
Well, bacteria put out odors. Foul smell can come from food that's stuck between the teeth that hasn't been flushed out.
Okay.
Bacteria create odors. We're all familiar with that. So when you smell a breath that's foul, it's from decayed, dead tissue.
Under the gum line.
Under the gum line, above the gum line, on the tongue. I mean, yes.